vakafaya vakautano wisdom one best masinire on the mic.
Good afternoon, Sister Sibanda. Welcome to our Fireside chat.
Thank you very much.
To start, may you please tell us more about yourself?
Okay, I'll talk about my professional self. I'm chief of Sibanda, and I'm rated as a general nurse and a midwife. I'm also a nurse educator, and I'm currently stationed in the School of Midwifery. Yeah, that's me.
Okay, may you also tell us more about your family?
All right. Probably the family that I have right now. But from where I'm coming from, I'm second born in a family of 6, 5 girls, 1 boy. But when I got married, I'm married to a single husband, and we've got 3 children.
Okay. Let's also talk about the hospital that you work at. What does it look like? Why do you like it?
Nyadire Mission Hospital is a mission hospital situated in Mutoko, and its mission it was actually established by the missionaries, and it has got a school of nursing and midwifery. What I like about it is that of course we are teaching students to be nurses, but they are also being enriched spiritually. And when you combine spirituality and being a nurse, they go hand in hand in as far as taking care of the patient is concerned.
Can you tell us more about the work that you do and what you enjoy the most?
I'm a nurse educator, right? And at Nigeria, we are training primary care nurses and midwives. And what I enjoy most is teaching students and getting the student to understand what I want them to understand satisfies me. And letting them understand is what keeps me going, and that's me.
Indeed, really do enjoy your work. Just to take you back, how did you become a nurse?
Okay. It's a difficult question, but my parents, I think it's the passion of having a nurse in the family, and my dad is the one who motivated me to be the nurse I am today. Otherwise, from the career guidance that I had, I was actually aligned towards being a lawyer, but here I am. I'm a nurse now because of the causing. But I have developed now the passion. Now I'm into nursing, that even to be asked to choose between nursing and being a lawyer, I would choose nursing.
So after getting your diploma in RGN, what then motivated you to then further do midwifery and then to become a nurse educator?
Okay. After completion of the training and diploma in nursing, I felt incomplete because I felt like I was lacking some knowledge on how to take care of a person from the grassroots. So then I decided to become a midwife, because just taking care of the pregnant woman and being the first one to take care to catch that newborn, something that kept me going within the nursing profession, and I felt I was satisfied by being a midwife. But then when I became a midwife, I also said, I think there's something that is big. I think I can do better than this. Why can't I become somebody who educates the nurses themselves and the midwives? Because I was actually having this feeling of being somebody who is capable. So that's why I then later advanced to the BSc nursing education.
Who has been your role model or mentor in nursing, and what lessons have you learned from them?
Okay. From the general nursing, I don't say I've got a lot of role models and mentors, but the one I admire most is Dr. Lillian Bozo, the Deputy Director of Nurse training, education, and administration. Why I admire her, she was once my teacher, and the time she was teaching us midwifery at Zimbabwean Maternity Hospital, I really learned a lot from her. And coming to today, she has kept on motivating me. She has kept on role modeling me, because she's one of the people at a level that you wouldn't think of her mingling, rubbing shoulders with other people of lower grades, but with her, everyone else is as important as anyone else. So what I've learned from her, I've learned to be humble. I've learned to be very assertive. Of course, there is this assertiveness that we are born with, but at times it can actually be boosted by seeing somebody. And when we talk of assertiveness, is to be trying to stand up for yourself, but without offending anyone. That's her. And that I've also emulated. I've also learned that it is important to develop yourself professionally, because it's your papers, it's your stationery that will take you to the position that you want to be.
Wow. I think our mentors make our journey, professional journey, so much easier.
Exactly.
And also, how do you see your role as a nurse in advocating for better healthcare policies practiced in Zimbabwe?
Okay. My role as an educator has got it brings with it positive impacts, because as a teacher, you are expected to be looking for the nutrients, new issues that are coming in. And when we get hold of those nutrients, the new issues, then I'm also going to impart the knowledge to the students that I'm training. And once I train a student who knows what she does, who knows how to take care of a patient with a new condition maybe, or those common conditions, then we are good to go.
How has technology changed the way you provide care and service, and what advancements are you most excited about?
As a teacher, technology has assisted us to be able to look for information anytime that you want, be able to give information to the students, and even to refer the students to look for their own information on the internet. However, coming back to midwifery education, we have embraced the issue of the e-platform, the e-learning platform for the midwifery fraternity. And just a few weeks ago, we launched this e-platform at Chinoi, School of Nursing and Midwifery. And how it is going to assist even on the patient outcomes, or even on the students, that when a student is faced with a challenge, when maybe even after they qualify, when they are faced with a challenge and then they're in the wards, they, for example, they may actually come across a breach, and then she or is no longer remembering how it is managed, she can actually open the platform and then look for breach, and then be able to take care of that woman.
Wow,
so it's a plus on us.
Exactly, and learning is becoming so much easier for students.
Yes,
wow.
Exactly.
Considering that you worked as a midwife, how did you incorporate cultural sensitivity in your nursing practice, especially in the diverse country in Zimbabwe, where we have so much different cultures? We have the Ndebeles, we have our Tongas, we have our Venda, there's the Zulus. Each and everyone have their own belief when it comes to the term to mudzimai asvika panguva yekuti ada kubetserwa.
Yeah. Thank you very much for that question, and I think it's more applicable to us midwives and as teachers, because Zimbabwe is transcultural, and that cultural diversity comes with its own implications, that if it is not handled well by the midwives, they can actually end up giving improper care to the women. Why am I saying so? I'm saying when the women came, whether they are pregnant or they're in labor, especially when they're in labor, that's where it is more prominent that they come, they've got their own beliefs. Some of them believe that if they do not take their African pitocin, then they are not going to deliver. So we embrace that cultural diversity. We are very sensitive about it, but what we do is we embrace those that are helpful, but those that are not helpful to them, those that are dangerous to them, we take it as a teachable moment, then we educate them to avoid those that put their life in danger.
And can we also discuss a time when providing patient-centered care led to a positive outcome for a patient?
Okay. Maybe let me just talk about what patient-centered care is. When we talk about patient-centered care, we are talking about offering individualized care. I would continue to refer back to midwifery because that's where the trust is. And now when pregnant women come, they are totally different. They are separate entities. They are separate people. So this, even if they present with the same conditions, how they present might be different, and the management that we give might differ because of that difference between them. So offering individualized care would actually assist the midwife to pick those complications that might not have been picked on the other person, even though they are presenting with the same condition. So it helps us to be able to treat women, to treat patients as different people, so that we do not miss any complications that improve their outcomes.
Last but not least, Sibanda, what advice would you give to new nurses entering the profession, especially in Zimbabwe, and also those who want they're looking forward to do their postgraduate training? What would you advise them how to choose their profession well?
Okay, thank you very much. Maybe let me start with those that are aspiring to become nurses.
Yes.
That this profession is a God's profession, and the patients are God's. So they should not just come over to try and become nurses just because of peer pressure or anything. They should have that caring mind. Their heart should be that of somebody who is really caring and who is really patient to be able to become a nurse. And for those that are in training or in other nurse, we are saying they should just love their job, because the moment you love your job, then you will get satisfaction from that. And I would also want to encourage them to avoid professionalism. I've always talked to the students that when you are training, we are all aiming for a nurse who everyone else will be proud of. So we expect them to uphold professionalism. How do they uphold professionalism? Is by just following up on the qualities of a nurse. The qualities of a good, of course, there are good nurses, there are bad nurses, but I want to talk about the good nurses.
They're always paid.
Yes, bad apples everyone. That yeah. So we are saying they should make sure that they keep in their minds the qualities of a good nurse, that they should be caring, they should be patient, they should have humility, they should be humane, they should be punctual, because the moment she comes late for duty, she reports late for duty, then it means some of the patients' wellness is going to be compromised. So we are saying to the nurse, just be yourself and love your job, and know that you are taking care of the patient on behalf of the Lord himself.
Indeed, that was powerful.
Thank you.
Thank you so much, Sister Sibanda, for the informative talk. We look forward to have you on our next fireside chat.
My pleasure, Dr. Karinda.
Vakautano, vakaupenyu. Vakautano,